Victoria's Royal Commission examining the state's mental health system has been granted a 3-month extension because of the coronavirus crisis. The Commission says the pandemic has taken a mental toll on many people, so reforming the system is more urgent than ever. Despite having to cancel its final round of public hearings, the inquiry is forging ahead in its work by moving online. Zalika Rismal reports.
On mute, Indigo.
Yeah, the cat actually did that.
It's a relatable working from home moment. Like everyone, Victoria's Mental Health Royal Commission is also grappling with how to do its work during COVID-19.
We've had to think of different ways of still collecting the evidence and the witness statements.
Indigo Daya was one of the first to testify from home with the support of her cat Angus.
It was a little bit traumatic, but it was also felt empowering.
A victim of childhood abduction and sexual abuse, Ms Daya spent 9 years in the mental health system as an adult.
It replicated the kinds of abuses that led to my distress in the first place.
Ms Daya says police forced her to hospital, where she was strip-searched, drugged against her will, left half naked in an emergency department for hours and locked in seclusion rooms following suicide attempts.
Imagine being the most distressed you've ever felt in your life and being locked in a tiny little room with a cardboard bedpan.
Advocates say the Commission needs to examine the quality of mental health services.
My concern is that with the pandemic and with the crisis, we won't really be focusing on that reform that needs to happen.
Ms Daya hopes the extra 3 months given to the Commission will allow more people to share their stories and help create a more compassionate system.
I am really grateful that I was able to testify, but I think it's not okay, actually, that so few people got to speak out.
The Commission's final report will now be delivered next February. Zalika Rismal, ABC News, Melbourne.